Have you ever felt an overwhelming urge to pull out your hair? This urge, if persistent and distressing, could be a sign of trichotillomania. Trichotillomania, also known as hair-pulling disorder, is a mental health condition. It involves recurrent, irresistible urges to pull out hair from the scalp, eyebrows, eyelashes, or other body parts. This behavior often leads to noticeable hair loss and significant emotional distress. People with trichotillomania may feel ashamed or embarrassed about their hair pulling. They may go to great lengths to hide their behavior, which can impact their social life, work, and relationships. Despite its prevalence, trichotillomania is often misunderstood. This video aims to shed light on this complex disorder, offering insights into its causes, diagnosis, treatments, and strategies for overcoming it. In this video, we will delve deep into the world of trichotillomania. We'll explore the various factors that contribute to its development, from genetics and brain chemistry to psychological and environmental influences. We'll unravel the complexity of this disorder. Understanding the causes of trichotillomania is crucial for effective treatment and management. We'll discuss the diagnostic criteria used to identify trichotillomania. We'll also emphasize the importance of seeking professional help for a comprehensive evaluation. Our journey continues with exploring various treatment options available. We'll discuss therapeutic approaches, such as cognitive behavioral therapy, CBT, and acceptance and commitment therapy, ACT. Research suggests that genetics may play a role in trichotillomania. Studies have shown that individuals with a family history of the disorder are more likely to develop it themselves. This suggests that there might be certain genes passed down through families that increase susceptibility to trichotillomania. While genes may increase the risk, they don't determine destiny. Having a family history of trichotillomania doesn't guarantee that someone will develop the disorder. Other factors such as environment and life experiences also play a significant role. Understanding the interplay between genes and other factors is crucial for developing effective treatment strategies. Our brains are complex organs, and imbalances in brain chemistry can contribute to various mental health conditions, including trichotillomania. Studies have shown that individuals with trichotillomania may have differences in brain regions associated with impulse control, habit formation, and reward processing. Neurotransmitters, the chemical messengers in our brains, also play a role. Imbalances in neurotransmitters like serotonin and dopamine, which are involved in mood regulation and reward pathways, have been implicated in trichotillomania. These neurobiological factors provide valuable insights into the underlying mechanisms of the disorder. They also highlight potential targets for treatment, such as medications that help regulate neurotransmitter levels. Psychological factors, such as stress, anxiety, and depression, are strongly linked to trichotillomania. Many individuals with the disorder report that their hair pulling is often triggered or worsened during times of stress or emotional distress. Hair pulling may serve as a coping mechanism, providing temporary relief from negative emotions or overwhelming feelings. For some, it can be a way to self-soothe or manage difficult emotions. Other psychological factors, such as perfectionism, low self-esteem, and body image concerns, can also contribute to trichotillomania. Understanding these underlying psychological factors is essential for developing personalized treatment plans. Our environment can significantly impact our mental health, and trichotillomania is no exception. Certain environmental factors can trigger or exacerbate hair-pulling behavior. Stressful life events, such as trauma, job loss, or relationship problems, can increase the risk of trichotillomania or worsen existing symptoms. Even seemingly minor environmental triggers, such as certain textures, lighting, or social situations, can elicit hair-pulling urges in some individuals. Identifying these triggers is a crucial step in managing trichotillomania. By understanding the environmental factors that contribute to hair pulling, individuals can develop strategies to avoid or cope with these triggers more effectively. Diagnosing trichotillomania involves a careful assessment of symptoms and behaviors. The Diagnostic and Statistical Manual of Mental Disorders, or DSM-5, outlines specific criteria to guide clinicians in making an accurate diagnosis. One of the key criteria is the presence of recurrent hair pulling, resulting in noticeable hair loss. Individuals with trichotillomania make repeated attempts to decrease or stop their hair pulling, but these attempts are often unsuccessful. The hair pulling behavior causes significant distress or impairment in various areas of life, such as social interactions, work, or self-esteem. It's important to note that trichotillomania is not simply a bad habit. It's a complex disorder with underlying psychological and neurobiological factors. If you suspect you or someone you know may have trichotillomania, seeking professional help is crucial for an accurate diagnosis and appropriate treatment. A comprehensive clinical evaluation is essential to understand the individual's unique experience with trichotillomania. This evaluation typically involves a thorough medical history review to identify any co-occurring medical or psychiatric conditions. A psychiatric assessment helps evaluate the individual's symptoms, triggers, and the impact of hair pulling on their life. The clinician will also assess the frequency, duration, and patterns of hair pulling behavior, as well as any associated rituals or habits. A physical examination helps assess the extent of hair loss and rule out any underlying dermatological conditions that may mimic trichotillomania. While the diagnostic criteria provide a framework for identifying trichotillomania, it's crucial to rule out other conditions that may share similar symptoms. Hair pulling can be a symptom of other mental health disorders, such as obsessive-compulsive disorder, OCD, or body dysmorphic disorder, BDD. In OCD, hair pulling may be part of a larger pattern of obsessions and compulsions, while in BDD, it may stem from a preoccupation with perceived flaws in one's appearance. Certain medical conditions, such as scalp infections or hormonal imbalances, can also cause hair loss and should be considered during the diagnostic process. A comprehensive evaluation helps differentiate trichotillomania from these other conditions, ensuring that individuals receive the most accurate diagnosis and appropriate treatment. It's important to remember that self-diagnosis can be misleading and potentially harmful. Seeking professional help is essential for a proper diagnosis and personalized treatment plan. Behavioral therapies have shown remarkable effectiveness in treating trichotillomania. One such therapy is cognitive behavioral therapy, CBT, which focuses on identifying and changing negative thought patterns and behaviors associated with hair pulling. CBT helps individuals understand the triggers that lead to hair pulling and develop healthier coping mechanisms. Habit reversal training, HRT, is a key component of CBT for trichotillomania. HRT teaches individuals to become more aware of their hair-pulling urges and substitute them with alternative behaviors. This could involve squeezing a stress ball, playing with a fidget toy, or engaging in any activity that keeps their hands occupied. Through consistent practice, individuals can break free from the automatic cycle of hair pulling. Acceptance and commitment therapy, or ACT, offers a unique approach to treating trichotillomania. Instead of focusing on eliminating urges, ACT encourages individuals to accept their thoughts and feelings without judgment. This acceptance helps reduce the power of urges and allows individuals to make conscious choices about their behavior. ACT emphasizes the importance of identifying values and taking actions aligned with those values. For someone with trichotillomania, this might involve committing to activities that promote self-care, reduce stress, or enhance their overall well-being. By focusing on values-driven actions, individuals can gradually reduce the grip of trichotillomania on their lives. While behavioral therapies form the cornerstone of trichotillomania treatment, medications can sometimes play a supportive role. Certain antidepressants, particularly selective serotonin reuptake inhibitors, or SSRIs, have shown promise in reducing hair-pulling urges in some individuals. SSRIs help regulate serotonin levels in the brain, which can improve mood and reduce anxiety, indirectly impacting hair-pulling behavior. It's important to note that medication is not a one-size-fits-all solution for trichotillomania. The decision to use medication should be made in consultation with a qualified healthcare professional who can assess the individual's specific needs and monitor for potential side effects. Medications are often most effective when used in conjunction with therapy, addressing both the biological and psychological aspects of the disorder. Beyond therapy and medication, there are several strategies individuals can implement to support their recovery journey. Support groups offer a safe and understanding environment for individuals with trichotillomania to connect, share their experiences, and learn from one another. Knowing that they're not alone in their struggles can provide a sense of hope and encouragement. Engaging in self-care practices is crucial for managing stress and improving overall well-being. This could include activities like mindfulness meditation, deep breathing exercises, yoga, or spending time in nature. By prioritizing self-care, individuals can develop healthier coping mechanisms and reduce the likelihood of resorting to hair pulling. Remember, recovery is a journey, not a destination. Becoming aware of your hair-pulling triggers is crucial for managing trichotillomania. These triggers can be internal, such as feelings of stress or boredom, or external, like specific situations or environments. Keep a journal to track your hair-pulling episodes, noting down the time of day, your emotional state, and any potential triggers that might have contributed to the urge to pull. This self-monitoring helps you identify patterns and anticipate situations where you might be more vulnerable to hair pulling. Pay attention to your body's signals. Do you feel a certain tension in your fingers or a tingling sensation on your scalp before you start pulling? Recognizing these early warning signs allows you to intervene before the urge becomes overwhelming. Trichotillomania can be an isolating disorder, but you don't have to go through it alone. Talk to trusted friends and family members about your experience. Educate them about trichotillomania, explaining that it's not a choice, but a complex condition. Their understanding and support can make a world of difference in your recovery journey. Consider joining a support group, either in person or online. Connecting with others who share similar experiences can provide a sense of belonging, reduce feelings of shame and isolation, and offer valuable coping strategies. Remember, vulnerability is a strength, and seeking support is a sign of courage. One of the most effective ways to manage trichotillomania is to find healthy alternatives to hair pulling. Experiment with different activities that provide a similar sensory experience or help you manage your emotions. Some people find relief in squeezing a stress ball, playing with a fidget toy, or engaging in activities like knitting or crocheting. Others find solace in physical activities like exercise, yoga, or dance, which release endorphins and reduce stress. Explore different options and find what works best for you. Remember, breaking a habit takes time and effort. Don't get discouraged if you slip up occasionally. The key is to keep practicing and reinforcing those healthy alternatives. Set realistic goals for yourself, starting with small, achievable steps. Instead of aiming to stop hair pulling completely right away, focus on reducing the frequency or duration of pulling episodes. Celebrate each milestone, no matter how small. Acknowledge your progress and reward yourself for your efforts. This positive reinforcement helps strengthen your resolve and keeps you motivated on your recovery journey. Remember, progress is not always linear. There may be setbacks along the way, but don't let them discourage you. View them as opportunities for learning and growth, and continue to move forward with compassion and determination. We've journeyed through the complexities of trichotillomania, exploring its causes, diagnosis, and diverse treatment approaches. From understanding the role of genetics and brain chemistry to recognizing the impact of psychological and environmental factors, we've shed light on this often misunderstood disorder. Remember, trichotillomania is not a character flaw or a sign of weakness. It is a treatable condition, and with the right support and strategies, you can regain control over hair pulling and live a fulfilling life. Seeking professional help is crucial for an accurate diagnosis and personalized treatment plan. Therapists can provide evidence-based therapies like CBT or ACT, while medication might be beneficial in some cases. Building self-awareness, cultivating a supportive network, and discovering healthy coping mechanisms are essential steps towards recovery. Be patient with yourself, celebrate your progress, and never give up hope. Don't forget to like and subscribe if you found value in this information.